Welcome to the Tarrant County Medical Minute podcast.
Well, Happy New Year, everybody. My name is Brian Swift, and I'm the CEO of the Tarrant County Medical Society. Today, I'm happy to be joined by Dr. Robert Rodgers, who is an allergist. He's been a longtime allergist here in Fort Worth. He's a former president of the TCMS, and he's our former TechSPAC chair, and he is a leader all things legislative for what we do here at the Tarrant County Medical Society. So Dr. Rodgers, thanks for being here today, and Happy New Year.
Thank you. It's good to be here. Thanks.
So why don't you tell us a little bit about your allergy practice and where you're from, where you went to medical school, things like that.
Okay. Well, I grew up in Denton, so I'm pretty close to home. Went undergrad to North Texas, actually lived at home, so didn't really have my college experience until I went to medical school.
Right.
Went to medical school all the way to Dallas at Southwestern, so stayed within 40 miles of home there, and then finally got out of state, went to Duke for my pediatrics residency, and then decided I might want to have a career in academic medicine, so I did a fellowship in allergy immunology in Denver. Decided then that being in the lab was not for me. I really liked patient care so much that I wanted to spend my life doing that. So I ended up finding a practice in Fort Worth, joined Bob Lanier and Norm Tremblay way back in 1984 and have been in that group ever since.
Great. Well, as you know, we have a legislative year coming up here in Texas. And for a lot of the people that maybe don't pay attention to what's going on here in Texas as it relates to our legislative process, Texas is a part-time legislature, which means they are in session every other year on odd years. So, of course, 2025, we are all hands on deck right now.
Right.
The other thing about the Texas legislature is that they only have 140 days to get things done. And the only thing that the Texas legislature really needs to do is pass a budget. But as we know, we have bills that come up fast and furious. In particular, if you go back to 2023, we had about 8,000 bills introduced, from everything to energy to healthcare, you name it. Of those 8,000 bills, TMA was tracking about 2,400 of them. So why don't you talk about how difficult it is for what we do to go down and lobby our legislative representatives and try to educate them on issues that are important to medicine and physicians and patients.
Sure. Well, it is an enormous challenge. Fortunately, we have a very talented and skilled staff that tracks all those bills and keeps the TMA leadership informed of problems that may be rising up or possibilities that would be good for us. And we also carry our own legislative agenda of items that we think are important to try to have either bills passed or to probably even more importantly, kill bad bills that could affect us in our ability to care for patients.
So why don't we talk about when you talk about killing a bill, right? Mm-hmm. And usually that relates, one of our big issues that we focus on is scope of practice. Mm-hmm. Why don't you talk a little bit about scope of practice bills, and when we talk about killing them,
Sure.
What does that mean?
Sure. Well, there are certain things that are very predictable in each legislative session related to practice of medicine. So there are always non-physicians that are trying to expand what they are able to do. The TMA stance consistently has been that if you want to practice medicine, you need to go to medical school and get your degree and be able to pass your boards and be able to deliver medicine in an appropriate fashion. So we always have that issue. And part of the reason I think it's so important for us to establish personal relationships with our elected representatives is that we need them to trust that when we work on these scope issues, we are doing it for the benefit of the patient.
Right, right. And what a lot of people, legislators, a lot of times, they have the best of intentions, but they don't necessarily understand the issue. And when you talk about a scope bill, for example, a lot of times we run up, it's like, well, having some kind of health care is better than no health care at all. Mm-hmm. And we would say to something like that, well, we see your point. However, there may be other ways to deliver that care. For example, telecommunications, right? Being able now with telemedicine to be able to have your primary care doc or be able to call you up as a person that has an established patient and say, you know what, I can see you over the internet and do your workup and patient information, then turn it over to somebody that doesn't have the qualification. So there might be ways to solve that problem.
Sure, absolutely. And I think we learned some great lessons about that during the pandemic. Right. Many of us who had never really thought about doing telemedicine became really skilled at doing it. Right. And I do think that that's, especially in a state like Texas, we have these large urban cities where we have lots of population, and access to care in those areas is limited only by whether you have insurance coverage or whatever. But we also have these big rural areas, and certainly Fort Worth, I think specialists in Fort Worth particularly are very familiar with seeing patients from West Texas because there are so many areas out there that don't have any specialty care available. And the distances are hard. Right. And a lot of those legislators in the rural areas need to understand how we can facilitate care for those patients.
Right. So when we're setting our priorities for the year and issues that we want to go and talk to legislators about, we not only do that just during the legislative session. We do this is a full-time, around-the-clock thing that we do to get a relationship, right? You don't want to be asking for things just in a legislative year. So we try to establish that relationship. And really, anybody can get involved in that. What would you say to a person that might be watching us that, you know, wants to get involved, but they're intimidated about these politicians?
No, I understand that. It was certainly not comfortable for me when I first started this. There are a number of different avenues to get involved. I think the easiest, the most comfortable way to get involved is for people to participate in First Tuesdays. So for any of you who have not heard of this, in the first Tuesday of the month, during that 140 days of the session, the TMA asks physicians and TMA Alliance members to come to Austin and to learn what the issues are at that up-to-date moment, and then to visit the offices of each of those districts. Like for the Tarrant district, we have our senators and representatives that we call on. That's I think a very easy entry point because there are many of us that have done it for a number of years that can kind of help lead the way and start the discussions. But then we also have new people that have fresh perspectives. We love having medical students and residents come because the legislators really like to hear from them, particularly on the issues of funding for residency programs, which is always a battle. So that's an easy way to get in. Another one that I think is overlooked and very powerful is to find some campaign that you want to get involved with. I started my experience in this working on Mark Shelton's campaign. Dr. Shelton, pediatric infectious disease physician, was one of our representatives. And the reason I think that's such a good starting point is that those people remember that you helped them.
Yes.
I mean, there are very few people that work on these campaigns, whether it's a representative or a Senate campaign. And if you do some volunteerism in those offices, you are golden with those folks.
Right, right. And, you know, why don't we talk a little bit about priorities and getting back to that. Certainly we have small practices like yourself. Yeah. We have large group practices. We have physicians that work for hospitals. We kind of all band together because our issues on 99% of these things that we talk with legislators about, we all have things in common, right?
For sure.
And I know there's probably people out there that say, well, really, I work for a hospital. Yeah. Those things don't impact me. What do you say to those docs that might be hesitant to come and join us on these first Tuesday visits that, look, they need to be a part of what we are doing?
Right. Well, the value of the TMA in this is that we do have all of those perspectives.
Yep.
No one has a corner on the market for this is what's important for physicians.
Right.
I certainly have issues and challenges as an independent practice physician. There are also employed physicians that have a long list of challenges of their own. So the TMA can coalesce around a number of issues that really do cross all of those areas. We all have our specialty societies as well.
Right.
And for issues that are more focused, those specialty societies can do some of that lobbying on their own, or they can also work through the TMA to try to accomplish some of those goals. But the overarching concern, and I think it sounds idealistic, but it's true, is that we maintain this focus on what's best for patient care. What is going to facilitate the highest quality, the broadest access, the independence of doctors and patients to do things that are the best for the patient. Those are guidelines that we can follow that cross through all those boundaries.
Right. So to put the fine point on First Tuesdays is that we would say, join us. We make it really easy. All you have to do is register, and you go to the TMA website to do that. Tell us you're going to be coming. We will set up the appointments. All they have to do is show up, and we have experienced docs like yourself who will be leading those teams, and we want them to join us so the legislators can hear directly those individual stories that they are dealing with, whether they're working in a hospital setting, a large group setting, a small setting. And we kind of share those stories, and the legislators love to hear that.
Right. Yeah.
So why don't we talk a little bit about, I mentioned in the beginning that you were chair of TMA's Text PAC. And a lot of people hear about, well, what is a PAC?
Right.
And why don't you tell us a little bit about what that's all about?
Sure. Well, a PAC is a mechanism to raise money to fund candidates. And it's a big process. Not only is it big in terms of just a challenge to convince doctors that it's worth donating to the PAC, but also the candidate assessment, how to figure out who is likely to win a race. I think this is an issue that required a lot from me, and I think requires a lot from most people that get involved with the PAC, of understanding that your own personal political philosophies and ideals may not be in the best interest of the TMA as a whole.
Right.
And that you may be donating funds to a PAC that will support candidates that you don't necessarily like.
Right.
But it is because the expert staff that we have assesses each of these candidates and their races and looks for ways that we can have influence. I think we have both heard many, many times that we may not think a representative is necessarily a friend of the TMA.
Right.
But there is a vote that we need, and they vote our way, and we either pass or kill a bill that either needed to be passed or killed. Right. And so having influence is important, and we need to have influence with the people. I say this all the time, with people that are going to be in the building.
Right.
We may have a candidate who is very friendly to all of the TMA's desires and needs, but that person's not going to get elected, and it's predictable that they're not going to get elected.
Right.
and it would be a waste of our resources to spend money on a candidate like that.
Right.
So it is hard because I think every single person, every single physician and alliance member could look at a particular race and say, I would never support that guy, and I'm not going to donate to the PAC because I don't want that person to be elected, and not realizing there are many other races that we're supporting that are facilitating what we need and supportive of candidates they'd like. So it's just a challenge.
Right.
It requires a lot of maturity.
Right. And as you said, I mean, on the outside, if you're not involved with what we are doing from a text pack perspective, if you're just going to look at that person, you might realize they're really bad on an issue for us. One issue or a just, things that we're never going to overcome with them. However, they might also be supporting us on 80% of the other things that we might be interested. So a lot of times, right, we love to pit Democrats against Republicans, this one against that one. But truly, we have to work with everybody, find the things that we can work with, and not dismiss a politician because they don't vote maybe on a particular issue our way, but we can use them in another way.
Well, think of all these years that you and I have been going.
Right.
We have met a lot of staffers in those offices.
Yep.
That the staffers, and they make a lot of the decisions. I mean, they facilitate a lot of the decisions that are made in those offices. And they aren't all politically exactly the same as the person they're working for.
Right.
And many of them are very, very well versed on our issues.
Right.
And the idea that we go year after year, every other year, and meet not only the elected officials, but their staffers, and to develop those relationships, it's really, really helpful. Right. And you get to learn that in some of these offices where you would say, initially, I certainly would, this guy or woman is kind of an enemy of ours. And then you learn there are people in that staff that you can definitely work with and educate, and they're interested in the issues that we have to talk about. It gives you some hope.
Yeah, it does. And the intimidation, this is what I love about it, is to watch you. I mean, I came from politics, but it's so fun to watch some of our physicians that have started out a little bit timid about how to deal with folks, and then all of a sudden, boy, just be leaders in what we are doing. And I think we do a pretty good job of bringing younger people around. If they are intimidated, we say, just come and watch what we do. And usually, right, by the second or third meeting, they're jumping in. They realize that they know more about the subject matter when it comes to their practices and patients than legislators will any day of the week.
Right. Well, I think you said something really important then that I hadn't thought about. On a particular First Tuesday, we typically have 5 or 6 appointments divided into a couple of groups.
Right.
Right. There's a lot of redundancy.
Right.
Right. We're saying the same things because we have the same issues to discuss in each of those offices. And, the people that go with us, they're very smart, bright, quick learners.
That's right.
And after the second or third visit of one First Tuesday, you kind of are getting the swing of it.
You are.
It's an easy thing to become comfortable with. And I think it's important, and we have had good success with this, of recruiting new people to come, continuing to develop that experience base, so that we have more and more people that know they may not be able to come every First Tuesday.
Right.
That's a lot.
It is.
4 days out of the office for a session.
Right.
But if you can come to 1 or 2, it's great. And then you can do that year after year.
Right. So, we talked a little bit about scope. Why don't we talk a little bit about a couple other issues, right, that are going to be on the plate, we know. So, prior authorization, right? The biggest, most cumbersome headache when we're talking about a person like yourself who has to hire, gobs of staff.
Well, it's ridiculous.
Isn't it, just out of hand?
And we thought we had made a major step last session
Right.
with the gold card legislation that was passed. But, we have some very skilled and wealthy opponents in the insurance industry, and they're figuring out ways around this legislation. So that's one of the things we'll definitely be working on this session, to try to tighten up those rules and try to facilitate getting rid of a lot of this red tape. This is pervasive in I don't know of any physician that's not affected by that.
Right. What about some other issues?
Well,
right.
Tort reform.
Yeah.
I want to bring this up because driving down here today, I was thinking, how long has it been? 2003 is when we passed in the state a major reform in medical malpractice rules. And that's 21 years ago. There are many doctors practicing in the state now that have no clue what it was like before.
Right.
None. And I think it's hard to keep generating the energy and knowledge that we have to protect that. Having a cap on non-economic damages in medical malpractice cases is huge. And the premiums that we pay for our malpractice coverage, the fear that we are under in practicing is dramatically different now and better compared to prior to tort reform. I'm old enough that I practiced before that reform occurred. So for younger physicians, they have to keep being interested in that issue. Many of us who lived through the bad days are going to be, retiring out of practice, but it's still important to maintain that. And the plaintiff's attorney lobby is constantly trying to tweak or do away with that. Yeah, I can go back.
Yeah, you can start from.
Constantly trying to.
Yeah, okay.
Yeah. The plaintiff's attorney lobby is constantly trying to overturn that legislation that we passed, that we encouraged, that the legislator passed. So that is always going to be on the table every single session, probably for the rest of time.
Right.
That's going to be important.
Right. And we know we have a shortage, right? And it's always going to be an issue, but Texas is blessed because of the tort reform that was passed. But you do have a lot of people coming, moving into the state. And history, if you don't know your history, you're bound to repeat, the mistakes of the past.
Right.
And I know prior to coming here, I did work for the AMA for a couple of years, and I had a number of states that I was responsible for, New Jersey, New York. You can't find an OBGYN. You can't find somebody that does pediatric brain surgery, right? And the reason they can't is because their liability is so great that they just can't afford to practice in those states.
Right.
And so we're blessed here, and we're one of a few states that actually have caps. Lots of states do not have caps, so we have to continue to fight. And we bring it up, but I think it's a good reminder that we need, again, all those people that don't remember the days of when really it was tough to practice here.
Right.
And so we're kind of in that heyday. We don't want to lose that.
Correct.
Right. So why don't you talk about, I know there's a big discussion, we can get into all the social, when we have things like abortion, things like that are controversial, right? We always talk about the bottom line, though, whatever your political position on very controversial things that medicine is involved in, we always talk about really the positions that we take as an organization really come down to patient-physician relationships, right? Correct. And why don't you talk a little bit about that we always have to keep that in mind, and that when we do go and talk to our legislators and we do have agendas at the TMA, that is first and foremost is patient-doctor confidentiality. And why don't you
and autonomy.
Autonomy.
Right? Sure.
Right.
Well, the certainly during this session, I think that's important. You mentioned that as a benefit of tort reform, we had many specialties that were eager to come to Texas, and certainly obstetrics gynecology was one of those specialties. Mm-hmm. And now we're facing some challenges with that same specialty because of the recent legislation in Texas regarding maternal health care. And we need clarification of that. There is an impact of that legislation on interest of young physicians in training coming to do residencies in obstetrics gynecology in Texas. So we really need to clarify that. And I think we get back to the point of our central focus on physicians and patients being able to make independent decisions that are in the best interest of the patient. Right. And if we keep that in mind, we can work through many of these challenging issues. Right. Now, we are not all going to agree on every component of that.
That's right.
But we definitely need clarification. There should never be a physician concerned about being criminally liable for a decision they make in the best interest of a patient.
Right.
That just does not seem appropriate or right. So and I think the intent of the legislature is to make that more clear, to give physicians more direction and take away some of the fears that currently exist.
Right. And we have been very clear as an organization, and that's part of what we're going to be doing for the next number of months, is making those sorts of things. And I tell you, we have Republicans, Democrats from everywhere. I see it every day. But boy, those are issues that we all come together on. There's never a question about that. And we can have our arguments. But we need, again, voices. We need people to be part of what we are doing. Mm-hmm. And so I hope this podcast is going to encourage people to get involved here, because we do make it easy.
Right. And I'm just going to put in a plug for any specialty, and it's very easy for me to label obstetrics gynecology in this. For this current session, we need people to come to First Tuesdays that are in those specialties.
Yes.
It is not impactful for me as an allergist to talk to a staff member or a legislator about these obstetric issues anywhere near as effectively as an obstetrician would.
Right.
Who can have real life experience about how decision-making has changed based on our current legislation. We just really need to have people in that specialty represented during First Tuesday.
Right. So it takes commitment. It takes, like you say, give us one. Right. Give us one First Tuesday. Mm-hmm. I mean, if you just start off doing one. So getting back to First Tuesday, because I want to, why don't you say, tell what a typical, what's your process, right? So you kind of drive down.
For me? Yeah.
Right. So drive down probably Monday night.
Mm-hmm. I've done it both ways.
Yeah.
I've been to many First Tuesdays. Some I'll just get up early Tuesday morning and drive down.
Right.
I mean, that's a pretty early morning. That's leaving around 5. But,
right.
But you can do it.
Right.
But I normally go down the Monday night before, spend the night. There is an orientation session at the TMA building for an hour.
Yep.
Often we'll have...
Bright and early.
Yeah. Often we'll have one of the elected officials come and talk with us during the orientation session.
Right.
And that's very helpful, because they'll actually say what their experience is of having physicians and alliance members come visit their offices during First Tuesday.
Right.
And that's very helpful. And then we have our schedule.
Right.
And we just walk a couple of blocks down the street to the Capitol and go in. And I certainly hope that people will continue to be somewhat in awe of just being in the building. Mm-hmm. It's a great facility. It's beautiful.
Right.
And
you guys wear your white coats.
Yeah.
Right.
And lots and lots of important things happen in that building.
Right.
And it's an honor to be able to be there and participate in the process.
And our legislators really do want to hear what you guys have to say.
Yeah.
They're very good. And a lot of times we walk in and we're, oh God, this is gonna be tough.
Right.
But we still always seem to be able to find things that we can agree on.
Right.
And so I think I want to end this podcast, and what I want to be able to do as the legislative session develops, we're going to be able to talk more specifically in the months ahead about specific things that are coming down the pike. Again, we might have our top 10, but we might be in a few months from now coming on here talking about, we need you to call, we need you to write, we need you to do those things to rally our troops to pass or defeat or let your legislator know. The other thing I think that we would love to hear from our docs out there are a lot of things that go on testifying before committees. And if you're a specialist, you talked about OBGYN, we're going to have a lot of committee opportunities. So if you are a doc that is interested in getting involved in testifying, why don't you just briefly hit on about that subject? Testifying, get in front of the committees, trying to get your point across.
Yeah, that is an ongoing process, even in the interim.
Right.
They have committee meetings and people testifying during those. It's hard for us in North Texas to participate in that because many of the committee meetings are announced only like a day ahead.
Yep.
And you get that schedule and you're going to hop in the car and go that day and cancel all your patients. It's difficult.
Right.
Fortunately, we have a lot of Austin area physicians that are kind of ready to do that. And many of our higher, our board of trustee members of the TMA make a commitment to help that. But we've had we have a number of physicians from Tarrant County that have testified. And it's, again, just another level of influence to be able to get in front of a committee and answer those questions.
Right. Because
they hear from a lot of people that are talking about medicine that don't really know medicine.
Right.
So
we're going to end with this. Get involved. We have a great system here set up for you to get involved. And so contact us. We have all our information. Click our links. And if you have any questions, please let myself know, Dr. Rodgers know. And we look forward to seeing you very active in these next few months that we call the legislative session of Texas. So get involved. We'll see you next time.